Isn't there a famous person called Jared Walker? More than like you
I'm
are famous, but like.
I'm definitely not famous, and I don't know. I think that there's like a hockey player,
Oh,
but
okay.
I don't know, and he's definitely not famous either. So I don't know.
Sabrosura pa' ti que qué.
Hola, hola. Welcome to Café con Pam. Aquí donde compartimos our stories sin censura, unmuted, and from our perspective. El día de hoy tenemos una conversación. It's kind of unusual because we have a conversation with Jared Walker. Jared is the founder of Dollar4, a nonprofit dedicated to eliminating medical debt for low income patients by making charity care known, easy, and fair. He launched Dollar4 in 2012 in Portland, Oregon, inspired by his own family struggles with medical debt. What began as a small initiative has grown into a nationwide movement. And today, Dollar4 has helped to raise over $75 million in medical bills, ensuring thousands of patients receive hospital financial assistance they never knew existed. Under Jared's leadership, the organization has simplified charity care applications, advocated for policy changes, and held hospitals accountable to their legal obligations. Bueno, esta conversación, I thought it was really important because I learned a ton of things I didn't know. Because one statistic that we talked about during the episode is that 22% of Latino households have medical debt compared to 17% of white households. And so Latina families have more, statistically speaking, more medical debt. And I think it's because we don't have access to this information that Jared and I talked about during this episode. And so this conversation, I think it's going to be useful and helpful. I hope you get to share it widely because everyone needs to know what's possible. You want to see más? Here's my conversation with Jared Walker. Jared, welcome to Cafe con Pam. How are you?
I am doing well. Thanks so much for having me.
Yeah, thank you for doing what you do. I think what you do is really cool. And I think we always like to give listeners context. So you run a nonprofit called Dollar4, and it started it was personal. Do
Yes.
you want to tell us a little bit about it?
Yeah. So my wife and I were sitting at home. This is 2012. So I grew up in the Pacific Northwest from Portland, Oregon, and we were at home, and she received a phone call, and her aunt had passed away from cancer. So that was the call that morning, and then about 30 minutes later, I received a phone call, and my cousin had gone into labor 7 weeks premature, and the baby needed a heart surgery to live. So it was like same day, same hour, both of our families hit with these medical emergencies.
Did you look at each other like what just happened?
It was like it was a total blur, and honestly, that same day, like, my sister got in a car accident, so it was just, like,
What?
this whole thing that was, like, not yeah, just a wild morning, and I remember the conversation, which is so common, was like, "How are we gonna pay for it?" Right?
Mhm.
What are we gonna do? These medical bills, and, I was 23, 24 at the time, and I had never experienced the US healthcare system in that way, and I was really frustrated that, like, just that reality of a lot of times, if you have a medical emergency, you are facing a financial emergency at the same time just because our system is so broken. So I was really, really frustrated by that. And I wanted to help people in that situation. How can I help people avoid financial ruin, from these medical bills? So I originally started Dollar for Portland, which was a crowdfunding
Mm.
platform that helped people pay medical bills. So it was very, very grassroots. It was mostly coffee shops, breweries, music venues, like small, uh, fundraising events. And then every month I would pool the money together and I would pay medical bills for a local family. So that is how Dollar for Dollar for Portland started, and kind of what sparked the idea.
How did you realize medical bills could be canceled or
Yeah, so
negotiated?
that was the so it's like the second thing that made me so frustrated was I did this for years. So I officially started Dollar for Portland in 2015, and from 2015 to 2020, I was doing the crowdfunding thing, and I met with an attorney, and he asked if I'd ever heard about hospital financial assistance, hospital charity care. He kept saying Section 501R of the Affordable Care Act, and I'm like, I have no idea what you're talking about. Uh, so I look into these programs and realize that most hospitals in America are nonprofit hospitals. They are tax exempt, and in order for them to remain tax exempt, which is very important for them, they have to provide community benefit. So one way that they do that is by reducing or forgiving hospital bills for patients that meet certain income requirements. And they just don't tell you about it, right? So I had been paying medical bills for like 5 years for families that all would have been eligible for these programs.
Oh.
So that was like the second thing that was so incredibly frustrating about this whole journey. It was like millions and millions of people are declaring bankruptcy or going on payment plans for bills that they don't have to pay. And it's because hospitals are not
Yeah.
telling people.
Oh my gosh. So many questions. Like, where do we even begin? So, something that actually prompted me to say yes to talking to you was learning that 22% of Latina households have medical debt compared to 17% of white households. And that's huge. Like, I learned so much learning about you. I learned so much. I didn't know we could call and negotiate. I landed in the hospital 2 years ago because I almost died and with my heart.
Oh my goodness.
Yeah, I have 2 payments left. So I was like, "Why didn't I like, I should have called. Maybe I should just be like, "Hey, can you just round it up and be done?" I should do
Yeah,
that.
we should talk about that.
It's like
We
200
should do
bucks.
that.
It's $200. But hey, that will pay for my dog's, like, medicine because I have an old dog, and he's on medicine now. So, like,
There you go. Every little bit helps.
every little bit helps. And so it made me think a lot about how we navigate, how I live in San Diego, for example, and my mom, she had really good insurance, but because the whole thing is like such a, I mean, it's a scam. It's such like, she never knew who was her primary care doctor. She never knew like who to call, how to get into what office. Like, you can't just walk in. So she crosses the border and goes to the doctor in Mexico because
Wow.
you just knock on the door in someone's doctor's office and you're like, I need to be seen. They see you. You're done. There's no this like,
Hmm.
we need to see your entrance and we need to like have you wait for 15 hours in order for us to tell you that you just have the flu.
Hmm.
And
Hmm.
so I think there's a lot of discrepancies for especially first generation immigrants that don't even know how the system works.
Hmm.
Do you have any thoughts on that? Do you think that's why there's a lot, like all this additional medical debt that happens?
Oh yeah, I mean, I think that that is a huge reason. I think that there is so one, navigating the US healthcare system is a challenge for anyone
For
anyone, right?
Americans.
Like I yeah, I mean absolutely. Like I am no joke. I have healthcare workers,
Yeah.
doctors, nurses, people that work at the hospital that are like, I can't figure this out. Can you help me? So it's not like this is something that is easy for anyone. It is extremely difficult. And then if you add any type of like any language barrier at all, like can I um, can I get the application in my language? Can I talk to
Right.
someone on the phone that can speak my language? And then you have a lot of safety net organizations that might exist, and can they help me? Right. So I
Mhm.
think that that's absolutely a huge part of it. And I would say that you have just an accessibility issue regardless, where you have, okay, there's the language thing, but then also like a lot of these hospitals are going to require you to, call the hospital, talk to someone, a financial counselor, and then that financial counselor will mail you a packet in 7 to 10 business days. Well, hopefully that is in the language that you speak, right? And if
Right.
not, then who do you talk to? And then even from there, most of the time, hospitals are requiring patients to fax or mail the applications back to them.
Can we make it more impossible?
Exactly. And it's like, so you have all of these things, um, and every little hurdle, it's like it is, and I don't want to beat up on hospitals too much, but like it is, uh, this is by design. How many little obstacles can we create for patients? Because we know that the drop off rate is just a little bit more after this one and a little bit more after this one. Because if
Mm.
hospitals can squeeze a little bit of money out of patients rather than write it off, they're going to do that. So um, it's unfortunate. But yes, I would say short answer, yes. I think that is a big contributor to it.
Well, and I love that you mentioned access because I think accessibility is there's so many layers to accessibility. You mentioned a lot of them is getting to the hospital. How many times I've heard my friends, and also we insert machismo of like, especially friends' parents, like, oh yeah, my dad. I was talking to a friend and she was like, my dad had this like pain on his side for like 5 days. And he was like, I'm fine, I'm fine, I'm fine, because men are not used to talking about pain or like whatever. And he never went to the hospital until he started peeing blood, like it was this
Hmm.
whole thing.
Hmm.
And it was because the kid, like his child, was like, you have to go. And that's another layer of access. The language that you mentioned, the negotiation, because we don't know what we don't know. I didn't know I could negotiate it until I started watching your videos. And I was like, wait. And even with there, I will layer the time that it takes because you have one
Oh
video,
yeah.
for example, that you called and you were on hold for, I don't know, because I don't know, but you were like, you just have to set time aside,
Yeah.
like take a nap, listen to the music.
It is. Oh man, yeah, we could continue going down this road because I'm writing down more. It's like you have, you mentioned transportation. Oh my goodness.
Right.
I mean, uh, that is huge barrier. And then
Yes.
what happens if you wait too long is a lot of times people in America will neglect care because they are fearful of the cost. So then what
Yes.
happens is they have to call an ambulance.
And then it's more expensive.
Exactly. So it's like the most expensive taxi in the world is,
Yes.
the ambulance is going to come pick you up. Then you have the cost as a barrier. We have, and then you mentioned education. And then the other thing is just like, yeah, access to these things, even access to the internet, because we have patients that have to go to their public library just to be able to get on our website. Right. So it's like, it is layers on layers on layers of, you know, these barriers. And unfortunately, dollar for, we are trying to help as many patients as we possibly can, but one very clear way that we could help more patients is if we had a call center. And we don't have a call center because it is insanely expensive, right, to employ people to sit by phones all day. But it's like, we know that we're missing out because there are a lot of patients that another barrier is trust.
Mm.
A lot of people do not trust the healthcare system, so they won't go in, they won't call. And we're this organization that can say, hey, we're the good guys, we're here to help. And even we can't do all the things that we should, like having a phone number that people can call. So uh yeah, we could talk forever
I
about
know.
it.
That would be huge. Maybe a text number.
Yes, we have text, we have email, people can do that, but it's, I would say, that's more of a barrier for maybe the older
Mm.
demographic that we serve. They want to talk to somebody on the
They want to
phone,
call.
right?
Yeah. They
Yeah.
want to know that you're here, probably. That's the other thing. Are you in the US? Well, especially because you probably do have to exchange some personal information. And yeah, the trust is big. Super huge.
Yeah. I mean, every hospital is going to require you. to provide some type of proof of income. So if you don't have, 3 months of pay stubs, if you don't have a tax return, if you don't have, bank statements, whatever, and then you have to get those, you have to print them out, you have to put them in an envelope, send it to the hospital. So, and then yeah, back to the trust. It's like, okay, well, this is personal information. I don't know if I want to give this to this hospital or nonprofit or whatever.
You talked about the ambulance, and it made me think of what I used to live. I live in the suburbs now, but I used to live in the city. And my office window was facing the street. So it was a lot of fun because I would see like people walking dogs and, you know, I was always distracted by like the city life outside. But that meant that I also got to witness like a lot of accidents. And
Mhm.
one time, remember the scooters? I don't know if you got them in Portland, but like one day we woke up and like scooters had landed in San Diego and
Yeah.
everyone was on scooters. So this person was in a scooter, obviously no helmet, like there were no regulations. Probably that's why they disappeared randomly one day. I don't know, I haven't looked into it. But person is like going on their scooter and then this car doesn't see them because there's no lights. It was that kind of like middle, like getting darker and it knocks him over. Like we just heard I was working and I just heard the car, like the tires.
Mm.
The person from the car got out and I heard him scream, please wake up" at the person on like the scooter. And I was like, "Oh my gosh, what just happened?" The person was passed out. They called an ambulance. Police showed up, all the thing. I mean, this is like right like I got all the cheese man, all the tea like outside
Oh
my
my
window.
goodness, that is like traumatic. I that is,
Yeah.
yeah.
It's wild. And so the ambulance shows up. The person at this point is conscious now. So he was able to get up and he fought the ambulance. Like he was like, "I'm not gonna get on an ambulance.
Mm.
It's too expensive."
Yep.
And I was like, "Oh my gosh." And so he asked to call someone. And then a person showed up and they left in the car. And the paramedics were like, "We just need to make sure that, you don't have broken things. Like you can just sit in the car
Mhm.
after you've been knocked over." And I think that happens often, which is kind of wild. Like it made me so sad that someone had just had such a traumatic thing and they had to think about how am I not going to get an extra bill to the hospital? Let's avoid the ambulance. It's wild.
There there are so many layers to that because one, I think I this might be old numbers, but I think the average ambulance ride is like $1,600, right? So I understand why you would tell, no. But then what's interesting, and this might be too in the weeds, but when you are working with insurance to try and get payment for whatever injuries you have, the first thing that they're going to ask is, well, did you take an ambulance? Because that's an indicator to them. It's like, well, how bad were you hurt? Because if you didn't take an ambulance, we are not going to give you as much money. So there is a whole thing on that of like people getting screwed again because they are fearful of the cost that they say, no, I'm not going to take an ambulance. And then they start getting questions like, well, were you really that hurt? Because if you didn't take an ambulance, blah, blah, blah. So yeah, it's wild.
Wild. Okay. So this is like infuriating and sad and frustrating and all the things. And I feel like anytime something like this happens, people in Europe, they're like, what is like,
Yeah, yeah.
how? I don't know if you've gotten those comments of like,
I talked to somebody this morning in Australia. It was like and they were so confused. They were just so confused. Yeah.
yeah, it's wild. So let's now give something for the viewers. If they have a medical bill, like I was in the hospital, my insurance thankfully covered a ton of it, but I got a $2,000 bill. And I was like, do I want to pay it? I'll just get on a payment plan. Whatever.
Mhm.
And I didn't think to negotiate it. That's the thing. But now I know what I know. I could have, I guess, right? And for those people that have received an extra medical bill that didn't expect, or maybe they got sick, what is the first step they need to do?
So I always tell people, take a deep breath.
Mhm.
You have time. Uh, a lot of people will panic because they start getting these letters and it might say, final notice, whatever, you might be sent to collections. Um, One thing to know is that medical bills cannot impact your credit score until it has been unpaid for 1 year.
Mm,
So that by the time you get that bill, you have a year to make a game plan. So you have
okay.
time. And no matter how many letters they send you, whatever, even if it gets sent to collections, it's still, it can be annoying because they're going to be calling you a lot trying to collect,
Mhm.
but
Mhm.
it's not going to negatively impact you. Um, Number one would be charity care. See if you're eligible for charity care. Most hospitals in America have these policies, um, and they're more generous than people think. So, a typical policy. I live in the Pacific Northwest, so all the hospitals here will waive 100% of your medical bill if you are at or below 300% of the federal poverty guidelines. So, what the heck does that mean? If you are a family of four, you can make around $94,000 gross annual income and still be eligible.
Wow.
I know, right? So that's the thing is most people just disqualify themselves. They say, "Oh, that's not for me. I make too much money." Depending on where you live, depending on what hospitals around you, depending on the cost of living in the area, these policies can be very generous. So
Okay.
you should see if you're eligible.
I mean, I owe $200. I should do that. It's a federal hospital. Does that still count?
I bet you they here. You want to do a little experiment?
Yeah.
What hospital?
It's UMC Nevada. I was in Las Vegas.
Nevada Hospital. UMC Nevada Hospital Financial Assistance. Okay. If a patient's household income is less or equal to 400% of the current federal poverty guidelines, you may be eligible for financial assistance. So, just as an example, like 400% for a family of four is $128,000. So if you
That's
are
wild.
a normal family in the US, you have a spouse and a couple kids or whatever, you can make over $100,000 and still be eligible at most hospitals. If you're in New York City or San Diego or LA or San Francisco, whatever, where the cost of living is higher, you most likely can make more money. If you're in rural Alabama, it's probably lower,
Right.
right? So it
But
depends on
you're
the
also making
hospital.
less money.
Exactly. So it's these programs. So I'm way off track, but number one, see if you're eligible for charity care. Most of these hospitals have more generous policies than people think. You can always go to dollar4.org. We have a database of every hospital in the country, all of their charity care policy data. So you can punch in your household size, your income, what hospital, and it will tell you if you're eligible. Um, so that there's that. And then if you're not eligible for charity care, and you make too much money or something like that, maybe the bill is too old, then I would say go to negotiate. And when negotiating, we can talk about that. But if you have some money, if you have a little bit of cash saved, you can offer less.
So you can settle.
Yes, I always ask, what is the settlement amount? Because they will take less most of the time. So those are kind of like step one, two, three.
Mhm. Well, I think settling, because I think I watched a video of you settling a bill. So I think you were like, I have $700 and the total was like 1,500 or something. And then you called and waited for 3 days, listening to
Yeah.
music.
Yep. Yep.
And then literally you said, hey, I have $700. And I think it was two bills. So you were like, my total amount that I have available is $700. Can you take like the 400 for this one and then the rest for this one? And in that case, I don't think they did, but then you, I think, got on a payment plan or something like that. But there's always a way.
Yeah, there's always a way. So that was I had two bills, and they were both from labs. So like blood work and whatever. So one of them I think was $1,200, and that one I was able to negotiate it down to like $375. So that was one bill.
Yeah.
And then the other bill, they would not negotiate for whatever reason. They wouldn't
Yeah.
negotiate. But I made a part 2 of that video, and I waited until the hospital or until the lab company sent my bill to collections.
Which is 60 or 90 days?
It depends. I think this one was like 75 days. So they
Okay.
I waited 75 days,
But your
and then I
credit's
got
not
the
affected?
collection notice. My credit was not affected.
Okay.
So I got the collection notice. So now somebody else holds the debt.
Right.
So then I called the debt collector and I got it negotiated down. I got it like 25% off. So not like the greatest amount, but again, like these things can add up. So, and it cost me a couple phone calls. So,
And a lot of time. But it's worth it, I think. And so about $4, I think where I find your organization really powerful is because when people are actually sick and getting those medical bills and they get like the last thing they want to think about is how do I pay this? And so that's when they can contact you and then you can help them figure that out, right?
yeah, so we are a free service. We are a nonprofit. All of our services are free. And if you have a hospital bill, you can see if you're eligible. We have all the paperwork. We have patient advocates that will help you. And, we have the template letters and we have all the resources for people. And we've been able to eliminate over $83 million in medical debt for people all over the country. So it works. And yeah, if you have a medical bill, please reach out.
That's so cool. Is there with the current administration are you being affected?
Um, I would say that we had some really big policy goals because right now there's a federal law that requires hospitals to do this, but they don't. So we need like better enforcement.
Mm.
And the current administration is not super interested in medical debt or whatever. So we have kind of had to take our policy efforts to the state level. So
Okay.
trying to get states to, you know, lock in patient protections at the state level. So that would be one thing. And then I do think that I th- I think in one way that it's impacted us has been through like philanthropy, donations and stuff. I think that people, a lot of foundations, a lot of because US aid stuff was cut, a lot of people are shifting where they're giving money. So
Mhm.
maybe we had, donors that previously would give to us, but they're giving it elsewhere, which is good. There's a lot of organizations that need help, but that's one way that it's impacted us.
For sure. Tell us all the places and spaces where we can find you.
So we are online at dollar4.org. We're on Instagram and TikTok at dollar4, and it's FOR.
Anything you want to share that I haven't asked?
Um, I always tell people there's no shame in medical debt. I feel like that's another barrier. People like any type of debt, people are embarrassed about. There's shame involved, and this has nothing to do with anything that you have done wrong. It has everything to do with a terrible system. So give yourself some grace, and don't be afraid to ask for help. That is why we exist.
I love that. Well, thank you for creating this.
Thank you so
I
much.
think it's an awesome organization. Yeah, that's helping a lot of people and may you help a lot more. Do you have a goal? How many people or how much money you want to save?
Um, we have a short-term goal. Like the goal is that we don't have to exist, right? The goal is that we have a healthcare system that doesn't bankrupt people. But
Far from that.
yeah. In the meantime, we would like to eliminate $500 million in medical debt for people in the next 4 years, and then our policy goal would be to create state policies in 3 different states that would require hospitals to screen patients for charity care before they bill them.
Mm,
So that is our goal. We've done it in Oregon, which is great, and we are
yay.
now working in California and Texas to try to bring the same law, so that if you live in those states and you have hospital bills, the hospitals will be vetting you for these programs before billing you. and we've seen massive impact in Oregon. And then hopefully we can show a model for the rest of the country. So
For sure.
that's the 4-year goal.
Love that. Well, keep us posted so we can sign the petition or do whatever we need to do to help.
I appreciate it. Yes, will do.
Awesome, Jared. Well, thank you so much for coming to Cafe con Pam, and thank you for all the work you do. And stay shining.
Thank you so much for having me.
Bueno, that was my conversation. I learned a ton. I hope you got to learn it too. During the conversation, I talked about my medical bill that I had that was $200. And I think if I had known earlier that I could request a discount, I would have done that. And so my goal is for you to have this information, not because you need it, but one of those just in case. And I hope it's useful. And so if you know anyone with medical debt, send this to them and just plant the seed, because we don't know what we don't know. And any bit of information might be useful that might get someone to even give them peace of mind. So if you're new here, please do subscribe, hit the bell, share the episode, leave a comment on the YouTube. If you want to explore other interviews, we have them, all of them on the channel. You can listen to them on the podcast. Let's stay connected at Cafe con Pam Podcast on all the places and spaces on the socials, cafeconpam.com. If you want to support us further, we do have the Supporters Club for $5 a month. It's a cup of coffee. I would argue less than a cup of coffee. It's half a cup of coffee at this point. And so that allows us to continue to create and build, and for the team to get paid to continue to create Café con Pam. And I thank you so much for being here. Bueno, nos vemos para la próxima con nuestro cafecito y sigue brillando.
Sabrosura pa' ti que